Hello guys, welcome back to the channel, and the subject what I'm going to take is MSN 1. It's generally found in BSc second year students, and I'm not sure at what year the GNM students get. And the first unit of MSN 1 is introduction. See, just introduction. So it doesn't mean that you can ignore this chapter. From this chapter you will be getting one question for 5 marks, that is the short essay one. So if you study this chapter, you are perfect with 5 marks. And this question pattern is according to BSc nursing students. It's not according to GNM students. The possible questions from this chapter will be provided at the end of the chapter. Now let's get into the chapter. First, what is MSN? The full form of MSN is Medical Surgical Nursing. So what is Medical Surgical Nursing? It is a branch of science and mainly a branch of nursing. In nursing you can see a medical surgical subject. This medical surgical subject deals with adult patients. Adult patients, no matter what the condition they have. For example, they are suffering from any respiratory disorder or cardiovascular disorder or a reproductive system problems or any kind of cancer conditions or any kind of blood transferring disease, inflammation, wound, accidents, anything related to any system, the care and the treatment will be provided to the adult patients. Based on the age, the drug dosage can be increased or decreased. For example, if the patient is very young, then the dosage will be very less. If the patient is very old, they can actually tolerate the dosage level, so the dosage level will be high in the adult patients. And based on the levels like mild, moderate and severe conditions, the treatment will be provided. And for some patients, just by using the drugs, the condition will be cured. But for some patients, we need to undergo surgical interventions. But in some conditions, both should be followed. For example, in the conditions like cancer or any conditions like removing a part of the body or removing a part of the organ, at that condition, surgical will be provided, and then after that, drugs is also given. In short, if you see, medical surgical is nothing but it is a branch of nursing which deals with the care given to the adult patients, and in this condition we will provide care to the patient, provide treatment to the patient no matter what the situation, no matter what the disease they have. Nursing. By hearing the word nursing or nurse, you'll get to know when we are suffering from the illness or any kind of injury, we go to hospital, there will be a person known as nurse, they will give care to us, they will treat us, and this is nursing. No, nursing is quite different. This is just a part of nursing. The main aim of nursing is to protect and promote your health. For example, there are lots of campaigns which will be conducted throughout the years, like how to protect yourself from tuberculosis, what is tuberculosis, what is malaria, how it is spreading from one person to another, what is communicable disease, what is sugar, diabetes and HIV, and very recent one, COVID-19. How to protect yourself from COVID-19, what is COVID-19. This nursing education care is provided to everybody, no matter you are suffering from that condition or not, just to protect you from that condition. And even after this precautionary measures, the patient gets those illness and he is suffering from that condition, then he comes to hospital, we will diagnose him, provide treatment to him, provide care to him, make sure he gets cured, and that is nursing. Health. If a person doesn't have any kind of disease or illness, it doesn't mean he is healthy. Health is seen in multidimensional way. For example, see, starting with physical way. By seeing physically, does he have any kind of injury, whether there is any kind of fracture or is okay. If he is physically okay, what about the mental condition? Does he have sound mind? Does he is oriented to till date, or he has some kind of mental problem? If he is mentally alright, what about the social condition? He is interacting with everybody, he is friendly with everybody, or he is isolating himself, or he is depressed. If he is socially alright, what about the spiritual condition? So, to make sure a person is healthy, we will see in multi-dimension, like physically, mentally, socially, spiritually. Not just the absence of disease indicates the person is healthy. Disease. This disease can be internally or seen externally. Internally in the sense, for example, infection, headache, fever, and hypotension, hypertension, diabetes mellitus, anemic condition. These are internally seen. Whereas externally, the structural forms like any kind of injuries, cut, burn, fractures, these are externally seen. So basically the disease is something that is, there is a demonstrable alternation in the physiological and structural of the body, and this condition will be diagnosed based on the sign and symptoms. For example, a person goes to hospital and says his complaint that he has a problem, that he doesn't have energy in his body, he gets fatigue very often, and he feels very low, he is unable to do his daily routine. On examination, like taking his vital signs and performing the blood examination, the result comes out that his RBC level is very low, the red blood cell count is very low, which indicates he has anemic condition. So based on the sign and symptoms, a diagnosis will be performed, and that condition is disease. It can be internally or externally. Illness is something which is internally seen in the patient. You can't see it because it is not physical injury to be seen. While it is felt internally, it's a feeling. The only thing that you get is the complaint from the patient that they are not able to do the work properly, they are not active, they feel very lazy, they need to rest, their body is aching. This is the complaint that you get from the patient, and that is illness. While it is purely subject to experience, and the main thing of this illness is it affects their daily routine work. They can't perform their function properly. Next, the type of illness. So based on the duration, the type of illness is classified: acute, chronic, and terminal. Acute is the duration that starts from few days to 6 months, whereas chronic, it is a condition which is exceeded the 6 months period gap, while terminal is condition where the death is the only hope. So acute is not a life threatening condition, but if we are not giving the proper treatment, if the treatment is not taken by the patient, then it can go to a chronic condition and it can become a life threatening condition. While chronic is like 50-50. If you are not treating, then it can lead to a death. Whereas in terminal condition, if we give treatment, you can expand the lifetime, like you can expand 1 month of life duration, but you can't save the patient from that condition. This is the type of illness. Level of illness. Based on the pain level, based on the suffering level, and based on those degrees, the level of illness is classified, and it is mild, moderate, and severe. And this is the pain scale. By using this, you will get to know what is mild, moderate, and severe. See, from 0 to 3, that is a mild condition, and in this condition the patient is quite okay. He has some pain, but it is bearable, he is quite okay. While in moderate condition, if you see, it's from 4 to 6, and this condition is quite painful. We need to provide medicine. This pain is bearable, but still we need to provide medication, we need to provide help to the patient. But in severe level, this is unbearable pain. It's from 7 to 10, and in this condition we need to provide medication, we need to provide help as soon as possible. This is the level of illness. Stages of illness. In this, you will see how a healthy person is getting converted to a ill person and how he is treated also. There are 5 stages. The first one is symptoms experience. First, the person gets the symptom. Few people will try to solve it on their own style, like home remedies and all. Few just ignore it. And in the progress to it, the second stage occurs, that is the sick role assumption. That is, the person start to feel internally that he is not well. That is nothing but the illness. He is not well. He can't perform the daily routine. There will be some kind of lacking in energy in him. He will feel very weak. That is the sick role assumption. When he started to assume that, he will contact the healthcare. That is the stage 3 condition. When he comes to hospital, there he will be diagnosed based on his signs and symptoms. Interventions will be going on. The medications will be started to given to him. And the fourth stage is dependent role. When the person is ill, he need to be dependent on someone who is giving care to him. So generally for a earning person, the head of the house will be finding difficult for it, and mainly the mother will feel very difficult because there is no one to care them. Well, dependent role is nothing but here the care is given to the ill patient. As the dependent role keeps on progressing, the person's health will be improving day by day. And the last stage occurs, that is the stage 5, the stage of recovery. When the treatment is successful, the stage of recovery occurs. This is the stage of illness.